One of the things that I hear most frequently from people is concern about diets. And this is true both for people and for animals. You know, there's so much confusion and misinformation and contradictory information out there about what a healthy diet is. And I think a lot of that about pets as well. The one thing I think we all can agree on is that the more processed food is, the more likely it is to be unhealthy.
Good morning and welcome to Pause, Reflect, and Heal with Dr. Randy. I'm very excited today because I have a very world-renowned MD with us who is going to help us figure out integrative medicine. He's been doing this for quite a while, so let me read you Dr. Andrew Weil's bio if I could. He is a world-renowned leader and pioneer in the field of integrative medicine, combining a Harvard education and a lifetime of practicing natural and preventative medicine. He is the founder of the Andrew Weil University of Arizona Center for Integrative Medicine. He is also a clinical professor of medicine and professor of public health. At that institution, a New York Times bestselling author, Dr. Weil is the author of 15 books on health and well-being, including Mind Over Meds, Know When Drugs Are Necessary, When Alternatives Are Better, and When to Let Your Body Heal on Its Own, Fast Food, Good Food. True Food, Seasonal, Sustainable, Simple, Pure, Spontaneous Happiness, Healthy Aging, and 8 Weeks to Optimum Health. Dr. Weil is a frequent guest on talk shows and the lecture circuit. He is the editorial director of drweil.com, the leading online resource for healthy living based on the philosophy of integrative medicine. He is also founder and partner in the growing family of True Food Kitchen restaurants. Andy, welcome to the show.
Thank you, Randy. Happy to be here.
Well, I'm really excited to do this, and I thought where we'd start off is kind of where I start off when I do my speaking on longevity and wellness, and that is basically talking about how kind of we both came into this world of integrative medicine. I know for you it was earlier than I, because basically you helped me find this in veterinary medicine. I've told you that before, but it is true. And so talk a little bit about, when you're basically your MD work, and then when integrative medicine really became kind of an idea for you or an option for you, or how that come about?
Well, first of all, I never practiced conventional medicine, although I was trained in that. I studied botany before I went to medical school, and that got me interested in medicinal plants, which has been a lifelong interest of mine. I began reading about alternative medical practices before I went to medical school. After I finished my clinical training, I felt that I didn't want to practice the kind of medicine I learned because I saw it do too much harm, especially in the form of adverse drug reactions. And also, I felt I had learned nothing about health and healing and how to keep people well, which I've always felt should be the main business of practitioners. So for a number of years, I made my living as a writer, traveled around the world, visited healers of various kinds, then settled in Arizona, and I gradually put together my own system, which I first called natural and preventive medicine, and then came to call integrative medicine. So that goes way back. And in the for many years, I had no interest from my medical colleagues in what I was doing. That changed in the early 1990s, I think, as the economics of healthcare began to deteriorate. And, now integrative medicine is a really robust movement in this country. I think it will eventually become a mainstream system.
Well, interesting, our pathways are so interesting because I'm also a Philadelphia guy. My minor in college was horticulture.
Really? I didn't know that.
I went to George Washington University, and actually my love was running the greenhouses. They were on top of the roof in Washington, D.C. And we grew all the plants for the FBI and CIA. So we had all the illegal drugs growing. We had poppy and marijuana. But what was really neat about it, Andy, was that my botany professor, who was also at the Smithsonian Institute, specialized in desert plants, but also in night blooming plants that, and most night blooming plants are very fragrant. So I would go up there and study all the time. It was like the best getaway. I could get away from the noise and be in this incredible environment, and I absolutely loved it. And actually, veterinary medicine came about because I loved the idea of being a detective, and I loved medicine, but I knew that at that point, psychosomatic disease was so common, and I don't mean that in the fact that it was just the way people were living and brought about all of these lifestyle problems with obesity and diabetes, and I really felt like animals were really my calling. And so I went through all the classical training back east, and I did an internship at Penn, which is unusual. Most veterinarians don't do a medicine and surgery internship. Was at the Animal Medical Center, which is the largest veterinary hospital. And I only tell you this because when I got into practice in Tucson, I was so disappointed, a number of years into my practice, that just like you said, I was putting out fires and I was using all these Western medicines, but I was really never seeing wellness and health. And I heard about you and then started reading some of your books, and I actually went to Albuquerque to study Chinese medicine. I actually went to learn about Chinese herbology, and I thought, I'm just going to add these Chinese herbs to my practice, only to find out I had to learn the dictum of Chinese medicine. And then that led off to acupuncture and then rehab therapy. And really, this integrative world for me, just like you, was very difficult. The veterinarians out there, and even many today, don't look at any of this stuff. In fact, when I've done podcasts or I've done radio shows, I've gotten calls from veterinarians going, what are you guys professing? There's no double-blind study on this. You're talking about this experiential practice stuff that you've learned, and it was very disappointing. So I know the uphill battle that you fought. I'm still fighting it to this day, but I want to thank you for leading the way, because honest to God, if it wasn't for you, it definitely wouldn't have happened for me. And it's been, I think the thing that's so nice for me is that it's a constant discovery. I'm still learning to this day, and that makes it very exciting. So,
our center let me just say, Randy, our center at the university, we have a fabulous new building. I don't know whether you've visited it yet, but please come. And it's it's the first academic integrative medical center to open within the heart of the medical campus of a major university. So that's a real milestone. And it's embraced by all the colleges at the University of Arizona. We have a lot of collaborations going. We have a relatively new school of veterinary medicine at the University of Arizona. And I am hopeful that we can have some active collaboration with them, especially to develop curriculum in integrative veterinary medicine. That looks like it might be an uphill fight, but I'm going to work on it.
Well, I'm there for you, and it's interesting that I've spoken to some of the top integrative veterinarians in the country. Dr. Marty Goldstein, Dr. Gary Richter. They're all on board if something was to happen at the vet school, coming to do lectures and being representative of their respective areas that they specialize in.
That'd be great.
I would love to see it happen, and so I'm going to stay after you on that one, because I'd love to see us try to do that. But like you said, it's a new school and they've got an uphill battle on their own, just getting programming and whatnot. So I know it'll be some time, but I'm looking forward to that.
I think the consumer demand for this is great, both for human medicine and veterinary medicine. So I hope that the professions will begin to respond to that more.
One of the things that I thought about is, before we move on to talk a little bit more about integrative care, is a lot of people ask about outcomes, because they're concerned that basically. I'm speaking about getting inflammatory things out of dogs' diets, and I'm speaking about supplementation and whatnot. And my producer asked me, what are the outcomes, allopathic versus integrative? And I go, when you have so many options to choose from in the integrative world that you could add to our allopathic medicine that we know, it just increases the ability to treat our animals. And I'm sure it's probably the same in people. And we've seen such great benefit from some of these herbs that we use and all the other things that we're professing in integrative medicine. So is that kind of a feeling that you have also moving forward for you?
Yeah, definitely. One of the things that I hear most frequently from people is concern about diets. And this is true both for people and for animals. You know, there's so much confusion and misinformation and contradictory information out there about what a healthy diet is. And I think a lot of that about pets as well. You know, the one thing I think we all can agree on is that the more processed food is, the more likely it is to be unhealthy. And I think, you know, the human diets have changed drastically in the past 50 years and not for the better. And I wonder about animals too, because my understanding is there really wasn't dog food around in the, you know, first part of the 20th century, that just people fed dogs scraps from the table.
Right.
And dog food is a relatively recent invention.
Yes. Yeah, and it's interesting that you mentioned that because what we now know is that humans consume about 59% of their diet as processed foods. Mm-hmm. Animals, we're at almost 90%. It's 89% because when you look at these kibbles, they're superheat processed, which gives us, you know, advanced glycolation end products and maillard reaction products. But then it's also air extruded and, you know, many times spray on like proteins and whatnot. So they're actually up to about 90%. And this processing has created tremendous problems for us. And in fact, I'm speaking to your group of alumni and fellows on Saturday, and my whole talk is really about integrative medicine in animals, but really how it affects us as people, because it, as you know, the correlate is right there. And you know, thank God things are getting out now. Dr. Karen Becker wrote a really good book called The Forever Dog, which is about the science of feeding a dog properly or a cat properly. And you know, my conversations with my rehab clients, my allergy people, my GI people, my cancer people, always number one is diet. Because these processed kibbles, like you said, Andy, you know, you and I grew up where the ranch or the farm was where these guys ate. You know, they got what we ate. They got table scraps. We didn't see the cancer rates. It's up to 1 in 5 in dogs over 10 and 1 in 4 in cats over 10. And you know, there's obvious reason. We've changed, you know, the epigenetics and nutrigenomics of these things and created this problem.
Yeah, I think that's also true in humans. We're seeing a great increase in autoimmune disease and allergy. And very alarming is rise of cancer in young people.
Yeah, exactly. And so, you know, I really appreciate going there with diets, and I know you've been, you know, a very big proponent on looking at certain supplements and you know, herbal products and whatnot, and I also, and so it's really been very helpful for us to get that conversation in place. And you know, the funny thing is you'll love this, is most people come in and I'm talking about this with their animal, and many times I'm looking at a body score of a dog that's like 7 or 8 out of 9, so they're obese, you know. And the interesting fact is that the Pet Obesity Project, what was started by a veterinarian in the Southeast, they looked at 50,000 dogs. And when you rate a dog's body score and you tell somebody that the dog is obese, the interesting thing is when you ask the client, is your animal overweight? And less than 6% will say yes, even though we know that they're way over there. And just cutting out some of that kibble, you know, getting to like a fresh whole food or a lightly cooked food or even a freeze-dried food as part of that kibble has made a huge difference in what we've seen.
Here's a question for you. My understanding is that one of the differences between dogs and wolves is that dogs can digest carbohydrate, and that was one of the reasons that helped them live in association with humans. How do you feel about carbohydrates for dogs, and what forms are okay and how much?
Great question. So I lead off my conversation with my pet owners is, no matter what, we want to eliminate rice, white potato, soy, corn, and wheat, the simple carbs. because we know, you know, that turns to sugar, and the incidence of cancer, you know, feeding cancer in Warburg reaction, and the things that we look for, that's the first thing. Dogs actually have a 0 carb requirement, which is amazing. So, you know, when they get their carbs from their vegetables, and you know, obviously some of the meats and stuff like that, that's a great way to go. But, you know, our dry foods, our kibbles, are anywhere from 40 to 70% carbs. So if I can just get, you know, you know, like you, I mean, I have large dogs. It's not always affordable to be feeding, you know, a home-cooked diet every night, or a simple, you know, slightly cooked diet like farmer's dog, let's say, or something like that. So if I can get, like, let's say even 50% of the dry food into a freeze-dried or partially cooked, or somebody's adding their own things at home, now I'm lowering that carb percentage to maybe even 20%, which is way, way better. And we've seen this in our rehab dogs, where the amount of inflammation goes away, and our GI dogs, our allergy. So that's really the answer. The answer is carbs are a huge problem. And the dog, I know you know Matt Coberlane.
Yeah.
He looked at in the dog aging project that if you calorie restrict a dog, meaning you lower their carbohydrate level, they can live on average 2.5 years longer.
Huh. That's remarkable. Yeah.
Yeah. Simple answer. So, you know, interesting. I want to ask you a little bit about what you're, you know, obviously you alluded to in people a little bit, the increases in cancer. We've seen an increase in allergies and autoimmune disease and GI disease. What's your thought? I mean, is your thought that this is mostly food, or is there other things involved here?
I think it's environmental in general, and there's probably many factors there. I think that the number of toxins in the environment that we're exposed to has increased greatly. You know, we've all been reading about microplastics, for example. I think a lot of the additives in food, industrial products, I think we're exposed to many more toxins than we were in the past. So I think that's impacting both humans and animals. And I think some, just as an example, when I was in medical school, pancreatic cancer was very, very rare. It's not anymore. And that's got to be something environmental.
Absolutely. Absolutely. And, you know, and I absolutely agree with you. I mean, we talk about epigenetics when I do my talks, and you know, this is the situation for our listeners, that we have, you know, we have a set of genes and whatnot, but we can actually change how they, you know, present themselves, how they work in our bodies, the same as in our animals. And when we're exposed to these things that you're talking about, it can actually change their expression. One of the things that we've seen, this is an alarming statistic, but in dogs that have gone to postmortem at the vet schools, they've actually seen a 30 times increase in glyphosate or Roundup in the liver. And you know, and I know. I mean, we're in Tucson. We walk our animals. The county sprays. The dogs walk out there, and then they lick their paws, or you know, they live on a golf course, or the owner or the neighbors are spraying. It's all over, and so this has to have an effect. And I have this mnemonic that I always put out called PETS, which is proper nutrition and microbiome, exercise, training, and stress reduction. And the stress reduction slide actually isn't about, like, you know, the dog living in a harried life at home, or, you know, people yelling at the dog, but it's really the stress on the adrenal gland with you know, cortisol and the flight and fight of all of these chemicals that they're fighting, and the things that they're, you know, the simple carbs in their food. And so, you know, even things like, you know, dog beds are made with a lot of PFASs and fire retardants, and carpeting has formaldehyde. All of this, you know, definitely affects our pets, and I'm sure, as you know, it's affected us.
So I think we have to take all steps we can to protect ourselves from environmental toxicity, and that means learning about, you know, what things we can do something about, like getting plastics out of our life, making sure your water is pure, not bringing any toxic things into the house. I think all of that we just take as many precautions as we can.
Yeah, and same goes for our animals. I mean, and this is, it so works so well going across species lines that Again, I'm in a consultation with a client, and they're using tap Tucson water, and I said, basically the hardness of our water, the high calcium levels, and certainly whatever else could be in there, if we could just filter that. I mean, I try to get them to a reverse osmosis system, adding back some trace minerals and whatnot. But you're absolutely right. And it's funny because then we'll talk to clients who are doing a great job on their feeding, but they're using treats that, again, are, there are companies, I won't even mention their name, but they're out there where, the first ingredient is sugar or high fructose, corn syrup. And, our dogs don't need this. Our cats don't need this, So it's like, we have to be looking at all those things, which is really important.
Randy, here's another question, a different topic.
Yes.
We've been watching this anti-vax movement among people, which I find very alarming as a physician. I think there are legitimate questions about, are we giving too many vaccines? Are we starting them too early and so forth? But, some of these diseases that we prevent, like polio and tetanus, if people experience them, I don't think there'd be any of this kind of sentiment. And those diseases are certainly going to reappear as vaccination rates go down. And I was very alarmed to read that a lot of dog owners are now not vaccinating dogs. And I think that's especially unwise with a disease like rabies, which, a terrible, terrible disease. How do you feel about that?
Well, it's a great question. And I had to go to my moral compass on this one because I'm with you. I mean, we see the advent of people coming into office that, profess this situation. And it's alarming in people what and as you know better than I, what could possibly be. We've done very well in veterinary medicine in preventing some really terrible diseases, distemper and parvovirus, and certainly rabies, as far as that goes. What I ascribe to now, which is really helpful, is I'm not an anti-vaxxer at all, but I will get my owners, once they've finished their puppy series of shots, often to think about doing vaccine titers.
Yeah, I think that's a good idea.
Yeah, Kansas State does a really, really good job on looking at distemper and parvo and hepatitis. They also look at rabies, and there is this is a little bit of a question that I'll throw it back to you a little bit, but so what I've found, Andy, over the years is if I can get my owners, instead of like yearly vaccinating to yearly titer, then I know basically pretty well that their distemper and parvo is good. We still have distemper in Tucson. We have, coyotes that run around. We still have parvovirus, same situation. Rabies is a little bit of a problem because, it's interesting that if you took your dogs to Hawaii or England, which are rabies free, you'd have to have a titer. They don't care how many vaccines you've done. If you don't have a protective titer, you're not getting in. So if that's the case, then my thought is that if we know that this is protective and this is the way that these rabies-free areas are screening them, why can't we even look at that in our situation? Now, here in Pima County, you can't license your dog if you don't have a rabies shot. Now, I've had a number of clients that refuse to do that and still get the titer. I don't let them go without vaccines. I'd still look at the titer. If the titer is protective, in two situations over the last really 10 years, I've had a dog scratch somebody or even bite somebody, and they weren't licensed. But I produced the titer, and not only the state veterinarian, but the county veterinarian is perfectly accepting of that, and basically we're done.
Good to hear.
So kind of that's how I've gotten around it. That's a great question, though, because I do think we over-vaccinate our pets. And, there's certainly, we've had so many cases, Andy, where we've seen, let's say, a cat get a rabies vaccine and 10 days later show us severe neurologic disease. So I have seen it. It's just that I make sure that we're not like doing nothing, because you're right. Once we drop all of this, we're going to see the return of these problems,
Yeah, no
just
question.
like we're going to see it in people.
No question. Yep. Recently, there have been a number of stories about bird flu and the possibility of that being transmitted to cats, especially, I think. Is that a real concern?
Yeah, it really is. And I think where that becomes a concern is in our raw foods, especially raw chicken products. I have definitely told my cat owners we want to totally avoid any kind of raw chicken products at this point. I don't know, and again, I probably should look at this. I don't know where freeze drying comes into this, and if we, deactivate some of this virus or not. I'm just having people stay away from it in all raw products, quite honestly. It's going to be a problem, and I'm sure you're kind of seeing kind of this buildup of what's happening. And then the question in humans, I guess I'll ask you, is if we do have this administration that says we're not going to do vaccines, and all of a sudden bird flu starts, and is there going to be a push to develop a vaccine for this, or are we just going to sit tight and see what happens?
Good question. I'm sure there will be a push to develop a vaccine. There will have to be.
Yeah, I mean, I would have to think so.
Yeah. No, I was pleased to learn that there's a center for a study of dog cognition at the University of Arizona. I didn't know that existed. And that's fascinating. There are centers like this at a number of universities, and people seem finally to admit that animals, at least dogs, are sentient. Obviously, I think all animals are. But trying to understand the minds of canines, I think, is a fascinating area of study.
And, we now know that their lives are so parallel ours. I mean, they're living in our homes. They're a part, I mean, I know you and I know me. They're part of my family,
Yep.
And my clients, as you know, I'm very fortunate in Tucson to have a clientele that believes that also. So it's great. One of the things I thought that was very interesting, and I'll ask you about, maybe if you have any thoughts, is, we do a lot more work in microbiome than they do in people. Not that they're not looking at it. And I just listened to I think it's Adam Perlman's lecture on microbiome that you guys had on at the Weil Center.
Yep.
The webinar. It was fascinating because I didn't even know they were looking at individual bacteria now to basically stabilize the gut or this. One of the things we've learned on our side is that the gut-brain connection is so intense that I have behavioral dogs, mostly dogs and some cats, but mostly dogs, that when we do an animal biome study through a company called Animal Biome, which is out of the University of California, Davis Vet School, they look at the DNA. When we balance that dysbiosis in their body, that imbalance of their bacteria and yeast and fungus, we actually see some of the behavioral changes. Dogs that have seizure less. Dogs that are aggressive seem to be less aggressive. And we can correct that through dehydrated capsules or FMT, fecal microbiome transfer. And it was interesting, I was at your seminar, that you have, the big meeting that you had last year, and I talked to the woman who's head of GI pediatric gastroenterology at Stanford. She was fascinating. I think she may be a fellow of yours, actually.
Yep.
And I asked her the question, we were in this lecture, and I'm the only veterinarian sitting there, so I'm feeling a little bit out of place. And they're talking about microbiome, but, they're not mentioning much about FMT or fecal microbiome transfer. And so I raised my hand at the end of the lecture, and I said, I'm just curious. I'm an integrative vet. We have been doing this for 10 years. And she said, oh, you guys are so far ahead of us because we have the FDA crawling down our back, but you have FDA and USDA, so you have a lot more leadway. And so I was fascinated in the fact that we've been really using this and seeing incredible results, and I know that a lot of that will transcribe to the human situation.
Yeah, well, there's a great deal of research on the hygiene hypothesis that kids that are raised in less clean environments are generally healthier, and that also goes for kids who are raised with animals, whether it's farm animals or pets. They are much less prone to allergy, to asthma, probably to autoimmune diseases, and this could well be through the microbiome changes. One of my Ridgebacks loves to kiss me. When I come home, he jumps up and kisses me, and I've always been fine with that. I think that's probably very good for my microbiome.
Absolutely. In fact, another study that was done at the U of A, which was very interesting on this subject was, and I learned about this kind of secondhand, they took some seniors here in Tucson who were living by themselves and and had no pets. And so they took a look at their microbiomes, every single one of them. I don't know how many there was, but it was a good study. And they actually gave them a foster pet for 6 months. And then they looked at their microbiome at, I think, 3 months and then again at 6 months. And they showed that that biome got so much richer and better. And the question was, is it because they're concerning themselves for these pets? Is it just what you're talking about, the contact with that pet to get some of these things into their body? But all in a positive direction. So it was, I guess the question is, was that pet ownership or was that pet contact? I don't know, honestly, but I think this stuff is really going to be fascinating coming up.
I agree. And of course, there's the whole more general area of improved health in people that have companion animals.
Yeah. I think there was an early study done in New York where they looked at pet ownership in New York City, and those who had dogs lived with heart disease lived a number of years longer because they had something to care about, because they were getting outside and getting exercise and walking the dog. All, as you know, is important stuff for sure.
Let me ask you about the rapamycin, Randy.
Yeah, I knew we were going to get there with this. Okay.
There are studies going on around the country looking at the possibility that rapamycin can increase longevity in dogs. And one of my dogs is on rapamycin. She has terrific energy, and I don't think we have conclusive data yet, but certainly looks promising.
Let me throw this back at you a little bit. So, I learned about this through Matt Coberlain's studies, and I know again, we mentioned him before, but he's done a lot with rapamycin, looking at, there was, and then I went back and looked at a lot of the data before you and I kind of decided on using this, and the data was impressive. I mean, really impressive in mice, obviously. And, low dose rapamycin. So for those of us who are listening to us, rapamycin is an antibiotic, basically. It was found on an isolated area, an island, and basically was used as is used as an anti-rejection drug in organ transfers and whatnot. But there was data that started coming out about its longevity and wellness effects and low dose. And so Matt looked at this really closely in dogs, and found that, well, the first thing that came out, which was really fascinating, Andy, was in hypertrophic cardiomyopathy in dogs and cats, especially in cats, rapamycin would not only slow the process down, in some areas potentially thought was going to reverse it. And there's actually an Irish company coming out with a rapamycin drug for cats for hypertrophic cardiomyopathy. And for those who are listening, this is an abnormality of the heart where the heart enlarges and is not beating properly. But what I was going to tell you was then, the idea of, well, the dog seemed to be happier. It seemed to be more active. Any thoughts on your end? Are you seeing any of that, or can you not tell?
Well, my 10-and-a-half-year-old female Ridgeback, who's been on it for about a year, has incredible energy. She just dashes about. She beats up my 5-and-a-half-year-old male Ridgeback, and she seems very happy. So certainly there's been a great increase in energy.
What do you think about the possibilities down the road for humans with this product? I mean, are you seeing on your side something?
I know a number of people who are taking it. I don't have, again, data. I'm not ready to take it myself,
right.
But I'll see. I mean, I'm open to it, and I think it's a very interesting compound, and probably in the doses that people are using, it's safe. And I'm waiting to see what we find out about it.
I think it's a fascinating situation, and I think the whole, the whole world of longevity and wellness companies coming up in the human world is just like unbelievable. I mean, it's just exploded. And I think there's a lot of mention in veterinary medicine about the use of peptides in dogs and cats. I know a lot of people are doing that in human situation. Again, I don't know how much data is out there. I don't know what you've seen, but I think healthy aging for you and I is going to be the ticket. I mean, I think that healthy aging is really where a lot of this is going.
Yeah, I learned that this center at the University of Arizona, one of the areas of research is dementia in dogs. I didn't know that dogs were prone to dementia. What's your experience with that?
I'm sorry, dogs are what?
Dementia.
Oh, yeah. Oh, my gosh. Yeah, so we call it in veterinary medicine, we've kind of relabeled it cognitive dysfunction syndrome. For lack of I don't know if it's dementia, I don't know if it's Alzheimer's, I don't know we have enough studies to know exactly what the brain changes are, but it is real. I would say honestly on a monthly basis, and of course I'm seeing a lot of specialty cases, so I may be a little bit askew on this, but on a monthly basis, I probably have 5 dogs that I see.
Really?
That exhibit
and what
signs.
are the manifestations of that?
Typically, the owners will come home and the dog is staring off into space, looking, backing themselves into a corner, not quite sure how to get out of there, not negotiating its normal kind of day-to-day functional type of things sometimes. I mean, it doesn't get so bad where, they totally, lose it. And, some of this is also related to the fact that many of our dogs go blind and the owners don't even know it because their sense of smell is so much more acute than their eyesight. But mostly it's things that you would think of that would be they're just not there. There's just not all there. And we always look for things that we can do. I actually, because I'm always searching for what can I do in this situation, go back to the food conversation, go back to some supplementation, omega-3s and things like methylcobalamin. We've seen some help. But I also look at the biome. Because again, I kind of feel that if I'm getting all the inflammation, am I helping inflammation in the brain? I don't know, honestly, Andy. I'm kind of striking out at things that I'm just looking for, quite honestly. There is a medication that we've used, because it's been advocated for this, called selegiline, which I know is used, I think, in Parkinson's disease in people. And in low doses, it does seem to help some of our really severe dogs. One of the things we see with these dogs is called sundowner syndrome. Yeah. And so at nighttime, they're barking excessively. They can't settle down. They're really, really having a hard time. And I found that the combination of correcting the biome, using low doses of selegiline, maybe a little bit of melatonin, has really made a big difference in these dogs and really helped my owners. The biggest complaint they have, as you know, is people can't sleep. So anyway. Yeah.
What about management of anxiety disorders in
Great
dogs?
question. I go right back to food conversation, the biome conversation, and obviously some of it has to do with training. There's a group in veterinary medicine called Fear Free, and this was led by a guy named Marty Becker, who is a veterinarian. He's been on Good Morning America and all that. And they advocate actually the use of low doses of gabapentin. Because gabapentin in dogs is a very, very good anti-anxiolytic without having to go to SSRIs and some of these other types of really heavy drugs. And I've actually, through that combination of food, biome, and some low-dose gabapentin, really been able to help a lot of these anxiety dogs. And then obviously some of them really need some help with trainers, and we have great trainers in Tucson that can help, with some of the things that may set them off. But the typical things like vet visits and airline flights and car travel, the gabapentin has been a great advent in low doses.
What about for fireworks and thunder?
This is even a harder one. So I have this program for fireworks and for thunderstorms. And as Tucson, when we get a good monsoon summer, it could be disastrous to some of these dogs. So if the owner is really willing to do everything, the first thing I go through is kind of a desensitization program. I have them get an environment's CD or record that basically is thunderstorm. And we'll start them off on very low doses. We'll do the things we talked about, like diet and biome and maybe gabapentin, starting them off like maybe for 2-second exposure to the noise on a very, very low level at their audio system. And then slowly over a number of weeks to months, build that up to see if we can desensitize the dog to those kinds of things, fireworks, thunderstorms. There's also a newer product that's out called Cilio. And Cilio is really much more for noise phobias. It's a combination of dexdomitor I think it has a little bit of butorphanol in there also. And it's worked really well in some really I mean, we have dogs, as you know, that they go through plate glass windows. I mean,
Yeah.
we've had dogs breaking through their houses with this stuff.
I told you I had great success with a cannabis product that I finally
Yes, yeah.
found that had, I think it was mostly CBG. And
Right.
that was one of the things that only things that really worked for my dog, who was very thunderphobic.
Yeah, and I'm glad you brought that up because I've stole that idea from you. I don't tell them where it comes from, but I've had that product. I've actually had really good results with. I've recommended that to 4 or 5 of my owners to add to their routine, and it seems like it really makes a difference.
Yeah, it really did. I tried everything with my female. I mean, everything, weighted blankets and kava, and I mean all sorts of stuff. And this finally worked.
Yeah, no question. What about when we talk about healthy aging in people, and quality of life type things? Obviously, diet, exercise, stress reduction, all of this is important. Is that kind of where a lot of our foundational docs are going with a lot of this?
I think so. This is all, under the area of lifestyle medicine, which is coming into its own. I think, another also very important is social connection. It really looks like social isolation as people age is one of the things that really gets in the way of health, and that probably applies to animals as well.
Absolutely, absolutely. A lot of our dogs, we like to try to recommend, if they can, to think about maybe a daycare situation where they're interacting with other dogs. The biggest problem for COVID for us was all of the adoption of these dogs in that time period because people couldn't, go out on their own. And we've seen a terrible increase in aggression in pets that we've seen because of the lack of exposure of socialization, whether it be other people or other animals. So, the thing about, one of the things I wanted to ask you about on stress reduction or healthy aging, before we move on, is is there a lot of mention about the environment at home, like these air fresheners and desanitizers and all that? I mean, is this something that is looked at a lot?
I don't think it's looked at a lot. It should be. I personally am very sensitive to odors, and I really cannot tolerate a lot of the fragrances that, if I get into an Uber or in a hotel room, I think these are, very not healthy exposures. So I try to eliminate that as much as possible from my living space.
And we do the same. I mean, we really look at a lot of this stuff in our pets. We've actually seen situations, it's really fascinating. I don't have any, of course, double-blind study to prove this, but we've seen situations where people have put in new carpeting, and the dog has just gone bananas as far as its skin allergies and its respiratory allergies. It's amazing.
And with their greatly enhanced sense of smell, I can only imagine what that experience is like.
Yep. Any before we wrap up, any thoughts for you about where life extension is coming in with people and kind of the newer stuff that's coming?
Personally, I think health maintenance is more important than life extension. The goal is not to extend the number of years you live, but to make sure that you remain healthy as you age and have a rapid decline at the end. That's called compression of morbidity, where you're trying to squeeze the time of disability and decline at the end of life into as short a period as possible. And I think you do that by focusing on all the factors under our control that you mentioned, diet, nutrition, exercise, stress reduction, adequate rest and sleep, socialization, and using preventive medicine wisely. So yeah. I think that's the goal, is to delay the onset and reduce the risk of age-related disease.
Yeah, I mean, I of course, I'm a fan of all of this, and I look at it in myself, obviously, and looking at things like Peter Attia, if you know that name. I mean, yep. Some of the things he's doing, he's talking about medicine 3.0. I like to think that I practice medicine 3.0 in veterinary medicine because, we're not just skimming the surface of the, let's just get the immunizations and let's look at the blood work and this, but really what can we do to make this pet healthier whether it's exercise, whether it's diet, whether it's microbiome, which again has been such a great advent for us. I was going to mention True Food Kitchen because that concept in itself for people is so great, and we've been there a number of times. By the way, we really enjoy it here in Tucson. Is that doing well? Is that taking off?
Yeah, it suffered during COVID, as all restaurants did. But yes, it is. We have, I think, 45 of them now around the country.
Oh, wow.
So, it's a robust brand.
Yeah. We need to start thinking about that for our pets. I mean, there's a company called Just for Dogs that started in California, which was doing a lot of lightly cooked foods and really balancing their diets. And then this company called Farmer's Dog, which is taking off, which is really, they're doing well. I'm still trying to work with these guys as far as getting the simple carbs out of their foods, because it's not necessary. But I think we're coming, and I think we're going to see it in veterinary medicine. And just like you, this is kind of where I'm going with my talks and what I'd like to see my owners do. And I think, thanks to you and thanks to, hopefully people like myself and the other integrative vets that are out there, we'll get this moving along.
Good. Well, I see a real convergence of our work, which is makes me very happy.
Andy, thank you so much for being here. I know my audience will love this. I want to remind everybody when they listen that you can go to my website, which is drrandypetvet.com, and ask any questions. Certainly, if there's something that comes up for Dr. Weil and I can relay that to him, I will do that. I don't like to bother him. He's a busy guy. But we're going to keep on working on this integrative veterinary tract. This is something that really excites me, and hopefully I've got some requests to speak at some of the vet schools and some of their holistic integrative clubs, and hopefully we can generate some enough interest to get this going here. I think if we could let the U of A be that leader like it is at the medical school with the Andrew Weil Center, and if you guys get to Tucson by any mention and you can see the center, it's an incredible building, it's an incredible place. They're doing great work, and I'm very excited to be a little part of that sometimes with them. So it's really fun. Thank you again.
Sure.